Good morning, and welcome to Health Talk here on AM 1270 and 96.5 FM KXBX. Paul Thomas in the studio with Bill Kearney of Northlake Medical Pharmacies, back at work after a long Labor Day fair weekend. Bill, you were out there multiple days. I was out there multiple days. I guess that's just what happens when you're in a small town and the fair comes to town.
And it's a little warm. And
oh, man, it was just brutal.
You're trying to hydrate yourself as much as you can with water, and you're selling beer, and it was. And then I also worked the sale barn for the 4-H sale, and that was really warm.
I can imagine. Yeah, and then I was told that on Sunday they were a lot of the 4-H were taking their animals home because it was so hot.
Were they?
They were taking them home early. Yeah.
Well, this one wasn't going to be taken home. He was going to go.
He's going to go home in a different way.
Home for harvest. And I had a good friend that is very well educated, and I was walking around to go pay for my lamb, and she said to me, "What did you buy?" And I said, and she's a city person, and I said, "I bought a lamb." And she says, "Why would you buy a lamb?" And I says, "Why not?" I said, "I love lamb." And she says, "I could see buying a sheep, but not a lamb." And I says, "A lamb is a sheep." And she says, "No, you know, a goat's different, a sheep's different, and then a lamb's different." And I said, a lamb is just a baby sheep.
Just a baby sheep, yeah.
I thought that was a completely different animal. I said, "Well, I'll have to have you over sometime and give you a lamb chop. See what the difference is." But it looked like the sale was well attended.
Do they sell sheep chops? They don't label them as sheep chops, huh?
Lamb chops.
It's just lamb chops, yeah.
But I think it was well attended. I was I started out at $7 a pound, and that's what they were all a few of them went for over $9 a pound. Of course, mine went for over $9 a pound. But it was wonderful to help out the FFA and the 4-H, and those kids are so great about telling you everything about their animal and what they weigh and how they've raised them. And there were tears at the end when they had to let them go. And I understand that because I was in 4-H in Iowa, and I raised pigs and dairy cattle, and also I had the reserve grand champion Black Angus my senior year in high school. So I know what it's like to raise one of those animals and then let them go to the stockyard for somebody to enjoy a great steak later. But excuse me, this smoke has got me kind of.
Yeah, is it ever going to go away? I mean, what is up?
I don't know.
There's tons of fires. If you look at a map, you can go to CAL FIRE's website, and you look at a map of the state, and knock on wood, everywhere else in the state has fires, but right here, in our area.
Yeah, but the smoke comes down.
The smoke is coming down, yeah.
I had Dan and I and another friend of ours had a fundraiser that we had auctioned off for Tango Mike. So we took our pontoon boat out and on Monday with 2 other couples, and they had bid to spend 4 hours with us out on the lake, and we took them around over towards Canocti and back towards Paradise Cove and back towards my death-defying stairway that goes down to the beach, and then over to a cove over by Ferndale, and then we got out in the water and we did hors d'oeuvres, and we did barbecued sausages and burgers, and had salads and desserts, and in and out of the water. The water was gorgeous. It was beautiful, and but spent all day doing that. And the smoke, when we went out, we left at 11. You could not even see across the lake at 11 o'clock. Yeah. And we left from Brado's. And it was actually dangerous going across to over by Canocti. There were boats going by us going 40, 50 miles an hour, and they couldn't even see in front of them. It was
wow. And people.
So when you have a pontoon like me, but you just kind of gradually go down the shore.
Right, yeah.
You don't worry about people passing you. I just worried about them getting into some kind of an accident. When I was doing bass tournaments here, sponsoring bass tournaments with the Record B and Bill Brunetti from Bruno's, sometimes the fog would be so bad in February or March you couldn't see. And there one time we had to actually cancel a bass tournament because it was so thick to see. But today we're going to be talking about lots of different things, and one of them about dementia, which is declining among older Americans. And don't let that mislead you, because that doesn't mean dementia is declining. It means that we're living longer, and the people that haven't got it yet, that are older, aren't getting it. But the millennials that are coming up that are getting it, still continues to increase. We're also going to talk about restless leg syndrome, some treatments that you can have, flu vaccines for all kids over 6 months old, and a lot of other things that come up, as well as, if we have time, we'll get into what it's like preparing for when your parents or yourself is not able to take care of yourself and have to go into a nursing home or a skilled nursing facility or a home where they have several families they take care of it and isn't skilled nursing. But this article was printed yesterday that was good news for American seniors, and that's the rate of Alzheimer's and other forms of dementia have dropped significantly over the last decade, or at least this new study shows. And it wasn't a small study. It was analysis of nearly 1,400 men and women that were 70 and older, and found that the number of dementia cases dropped from 73 among those born before 1920 to just 3 among those born over 1929. Now, that's out of 1,400 people. The reasons, aren't clear, but one factor stands out as the rates of strokes and heart attacks decreased across generations, but diabetes has increased. And it may be that we're all seeing the benefits of years of success in cardiovascular disease. That means in strokes and heart attacks. That's decreased across generations. And it doesn't appear to account for all the decrease in dementia rates, however. So the rates of dementia has declined, but the actual number of people with dementia is expected to increase dramatically as the population bubble caused by baby boomers ages. And I'll have to go back a step or two, because I'm sure there are people out there that don't know what dementia is. Dementia is when, as we begin to age, we start remembering less and less. And sometimes it becomes in an epidemic proportion where we can remember back maybe 20 years ago or 10 years ago or maybe 5 years ago, but not so much about what just happened. For example, if you ate breakfast this morning and then a couple hours later you wonder when you're going to eat breakfast. That's severe when it's going into something like Alzheimer's disease, which is an advanced form of dementia. Dementia usually precludes Alzheimer's, where you almost have to have round-the-clock care for Alzheimer's disease. Around the world, there's more than 47 million people suffering from dementia, and 7 million new cases appear each year. So when you hear that, you're thinking, how can that be a decrease? And it's going to double every 20 years to reach 115 million by 2050. We briefly talked about this a couple of weeks ago, because the number of people suffering from Alzheimer's disease, which is the most common cause of dementia, is expected to climb to 106 million by 2050. So 115 million of dementia and 106 million full-fledged Alzheimer's. While it seems like the rates may be going down, it's not going away as a problem. And as this dementia becomes an impairment of the functions that your brain has, marked mainly by memory problems and even personality changes. It's still one of the most expensive chronic conditions with a huge impact on patients and families. And why is that? Well, can you imagine coming home to your wife or your grandparent and after being gone for a couple hours, walking in the house and they're asking you who you are? And that's how aggressive it can be. You can have a loved one in a nursing home or a skilled nursing facility or an assisted living facility, but usually a skilled nursing facility, and spend all afternoon with them, and then come back the next day and they will accuse you of never spending any time with them. That requires somebody around the clock, and that's why it's the most expensive. And there was a thing in Consumers Report this week about the cost of having somebody in a assisted living or skilled nursing facility, and they went by state. The real dark orange, reddish countries or states were the most expensive, and the lighter colors were the least expensive. Some of the states were $84,000 a year. California was almost $49,000 a year to keep someone in one of those facilities. But this is about brain health your entire life. This report was published yesterday in the Journal of American Neurology. For the study, they analyzed the rate of dementia in those 1,400 men and women, and they took part in the Einstein aging study from 1993 through 2015. When they entered, they were 70 years old or older, and they did not suffer from dementia. Over the course, they found the rate of dementia dropped steadily. Among the 369 people that were born before 1920, 73 developed dementia. That number decreased to 43 among the 285 between 1920 and 24. And then it dropped to 31 for the 344 born between 25 and 29, and to 3 for the people born after 1929. I don't expect you to remember this, like I tell you on many things, but similar trends have been documented through Europe too. Much of the decline in the rate of dementia is the result of declining rates of stroke because we have spent so much time and money in treating cardiovascular diseases. The amount of strokes incidence has fallen. We now can, if you have a stroke, we actually have a stroke center at Sutter Lakeside in Lakeport. You can go and find out you're having a stroke, get there, get an injection to break up the clot, and hopefully you're okay and you live a long, healthy afterlife of that. The health of blood vessels in the brain contribute to the risk for dementia. So one would predict that over time, the reduction in stroke risk would be a precursor to that reduced dementia risk. Excuse me. The aging baby boom is such that the overall number of dementia patients will continue to rise, even with the prevalence of numbers that are falling slightly. So once again, the ugly head of the baby boomers, which I'm just a little bit ahead of, ends up being a huge cost. When people start improving their healthy conditions, the way they take care of themselves, then there's an increase in their lifespan and a decrease in things that cause them to have a difficult time making it. So we want to encourage people to have diet and exercise. That's always the big thing that we talk about, and that's the one kind of a treatment for almost everything we talk about is diet and exercise, diet and exercise, diet and exercise. So we're hoping that you listen to that and do part of that. I had a report from the WebMD, which is a great website that's free on the internet, and they have two sections. One's from the United States and one is from the UK. And they actually did a study on, is your heart older than you are? And September 4th of 2017, the review came out, and 1 in 10 men aged 50 that are effectively 10 years old, their hearts are 10 years older than they are likely to die sooner from heart disease. And the findings by the public health group in England was based on the analysis of 1.2 million heart age test results, of whom 33,000 were aged 50. And it's the leading cause of deaths among the men in England and Wales, and the second among women. And according to the public health department in England, 7,400 people can expect to die because of heart disease or a stroke in England a month. A quarter of the deaths occur in people under 75 years of age, and most of those could be prevented. So around half the people taking the test that was launched in 2015 were aware of their blood pressure numbers, and of that, the 5.6 million people in England currently have high blood pressure without even knowing it. That's not unlike this country. Because it's called the silent killer, we don't realize when we have high blood pressure until we have a cardiovascular event, and then we realize that something's wrong. If you're into the way that you feel and you've had high blood pressure and you're on treatments and you're not taking the medication, you feel it. Now, there's a lot of our patients right now that were taking a beta blocker called altenolol or tenormin. And recently there's been a worldwide shortage of altenolol. We're starting to get 100 milligram strengths back and 50 milligram strengths back a little at a time. But it's hard for you, if you're taking 25 milligrams, to cut an 100 milligram in quarters and get the right amount. But most of those patients have been switched to another beta blocker called metoprolol or metoprolol succinate. Does the same thing. I happen to have been on that medication before I was on altenolol, and a lot of people are neglecting to take that because they want their altenolol back, which is coming back gradually. So call our pharmacy and there's a chance we have it back now. But as soon as you don't take that medication, after taking it for your high blood pressure, you feel different. That's a sign that your body is saying, I'm used to having that medication control my cardiovascular system, my heart, my lungs, and that's not happening right now. And we need to do something about it. And if you continue to not take it, number one, you'll go through withdrawal, and number two, you could very easily have a stroke or a heart attack. The other medication shouldn't make any difference about how you're treated, should be just as effective at lowering your blood pressure, and also should be just as effective at keeping you steady without any side effects any more than you had with the altenolol. But getting your blood pressure tested in your nearest pharmacy or health center can be the first important step in prolonging your life, especially if you don't see a physician. And as we've talked about many times on this show, that's becoming more the norm than the unusual situation. There was just an article in one of the papers a couple of days ago about how to handle the physician shortage in the United States. The main risk factors, and I'm sure you've heard these before, are smoking, a high-fat diet, diabetes, high cholesterol, high blood pressure, being overweight or obese. And people with a high heart age have a higher risk of a range of health problems, including dementia, heart attack, strokes, kidney disease, and diabetes. And the health experts are encouraging people to make such changes and, of course, taking more exercise. I know we never want to hear that word, but if it's going to, you know, there's a thing about life. Do you want longevity or do you want quality? And if you want quality and longevity, you have to do both, diet and exercise. This professor of cardiology who led the development of the heart age test said in a statement, I call it investing in your arteries. It's about convincing people in their heart healthy matters. If they take action early in life and sustain that, they will get a big lifetime benefit of their future. Out of all the people age 30 and over who've taken the test, 12%, these are 12%, had a heart age at least 10 years older than real age. These people were 30 and over. Just think what it is at 50 or 60. And all we're saying is today is about really taking care of yourself. I have to tell you a story. I was talking to somebody at the fair, and their parent had a situation where he had blocked circulation in the extremities. He went to a hospital, and a clinician said, we found the blockage in your leg. We will be able to treat that. You'll get circulation back in your extremity and your toes. And his he was extremely fortunate. They sent him home. He had other disease state risks, but eventually his toes started turning black. And they went back down to see the physician in the hospital, and he said, well, your toes are just going to fall off. And the patient said, why didn't you tell me that? Why didn't you tell me I was going to lose my digits on my feet? And they said, well, didn't we tell you that? I said, no. You know, you told me I'd be just fine, go home, I'd have circulation back in my extremities. And that's the kind of thing we're running into more and more when you have, you don't have a family practitioner. You see a PA, and I'm not sure if this was a physician, I assume it was, but likely not. If it was a procedure that was done to undo the blockage, it was probably an assistant or an aide or a health practitioner, and they're so busy, and they probably assumed that this gentleman knew this already. But those are the kind of dangers we face, and that's why when we talk to you about having a physician's visit, we give you a series of questions that you should ask the physician about the medication, about what they're being treated. Is there a side effect to the medication? There are several medications we dispense that have black box warnings on them, and we will ask you if you would mind us consulting you, about any side effects of the medication. They said, no, the doctor already told me that. And sometimes we'll insist on giving you consultations anyway, because the law requires us to do that, and you have to sign a piece of paper or an electronic data thing that says, I don't want you to tell me about this. But we really hesitate when that happens, and that's why we have to have a signed signature that says you didn't want to hear about it. And we especially do that on medications that are new to you, or medications that you've been taking previously that have different directions on them. During the atenolol crisis, I had to switch from 1 milligram to a higher milligram, and the dose was changed to a half of a tablet every day instead of 1 tablet every day. And being a pharmacist and not filling my own prescription, I just, when I'm there, I say I need these prescriptions filled. Nobody told me that. Now, I always tell everybody when they come in after they've taken their medication wrong, number one, check and read the directions and make sure they're the same. And a lot of times we switch manufacturers, and we will have a sticker on there to tell you that that drug has been changed. It may look different, but it's exactly the same medication, and you will see a thing on your label that tells you what it's supposed to look like. Is it round? Is it square? Is it oblong? Does it have a number on it? What color is it? In this case, it was exactly the same medication, only in a higher strength, and nobody told me to take half of a tablet every day although that's what it said on the label. Did I look at the label like I should have? No. What prompted me to look was the tablet was twice the size, and it was 100 milligram instead of 50 milligram. My bad for not paying attention to that. Their bad for not telling me. But sometimes when you're a health practitioner, people assume you know everything, and especially if you're a pharmacist and dispensing medications, that you would be aware of that. Sometimes we anticipate that, and sometimes it's true, and sometimes it isn't true. All right, we're going to lighten things up a little bit here, Paul, because do you ever yawn? I know you used to yawn a lot.
Everybody yawns, right?
They do, and
Isn't it because you're lacking oxygen in your brain or something? Is that what I've heard?
It's a stimulant, and it's something you can't stop.
Yeah.
The contagiousness of yawns may be rooted in primitive brain reflexes. Echophenomenia is the term of contagious movements such as yawns. We tend to yawn when we see others yawn, and so do chimpanzees and dogs. So researchers in England at Nottingham wondered where the roots of this was. They examined 36 adults, and as they looked at video clips of people yawning, they were told either to try to stop themselves by yawning or just let it happen. They found that it was harder to resist yawning when you see someone yawn, and the urge gets stronger when you're told not to do it. So they also found that people differ in their vulnerability to yawn. So they suggest that those findings may be partially important in understanding the association between motor excitability in your brain and the occurrence of this phenomenon, such as epilepsy, dementia, autism, Tourette syndrome. With Tourette syndrome, you get people that have this audio, they have a tic, and they'll yell or scream or something. They don't even know they're doing it. The research has shown that the urge is increased by trying to stop yourself. So the more you stop trying to yawn, the more you yawn. And this is very prevalent in meetings. You have sale meetings every Monday?
We do.
And probably lucky that it's fairly early in the morning.
Yeah, they 8:30.
I'm usually a speaker at nighttime or right after lunch, and it's very hard to see people not yawning, because they are. There is in Tourette's, if they could reduce the excitability, they might reduce the tics, and that's what they're working on. They think with electrical stimulation, it suggests that the brain's primary motor cortex plays a role in contagious yawning. So don't feel bad if you start to yawn and you can't stop, because the more you want to stop, the more difficult it is to stop, and you'll just make yourself a spectacle at your boss who's trying to stimulate you to have a sales meeting. So we're going to take a break. When we come back, we're going to talk about restless leg syndrome and some of the symptoms and treatments and more about that. Have you been reading, seeing, and listening to all the concerns about the cost of drugs and the cost of health care since the election in November? Hi, my name is Bill Kearney. My wife Dana, myself, and our employees have been bringing medication and medical supplies to our patients in Lake County for the past 38 years. Our efforts to convince the employers in Lake County that our services here are valuable to people like yourself have been mostly overlooked. As we continue to be a major sponsor of different entities and organizations in Lake County, please remember our support of your organizations. We love Lake County and all of you who have made this such a wonderful place to work and live. So the next time you get a new prescription or refill one of your previous prescriptions, come give us a try. I'm sure you will notice a difference. Getting a prescription from one of our pharmacies just might be one of the best parts of your day. North Lake Medical Pharmacy, with 2 locations, on Hill Road East across from Cedar Lakeside Hospital, or outside the Bruno Shop Smart in Lakeport.
This is the Caltrans Road Information Bulletin for Lake and Mendocino County State Highways for the week beginning Friday, September 1st. No planned work from the 1st through the 4th due to the holiday weekend, but crews, of course, will respond to emergencies. In Lake County on Route 20 near Stokes Court, expect 5-minute delays weekdays. On Route 29 from Hofacker Lane to Martin Street, expect 5 and 10-minute delays weekdays. And on 175 near Arroyo Vista Road, expect 5-minute delays weekdays. In Mendocino County on Route 1, expect weekday delays in multiple locations. On Route 20 west of Chamberlain Creek, expect 10-minute delays weekdays. On Highway 101, expect weekday delays in multiple locations from Crawford Creek to Confusion Hill. On 175 near the Lake County line, expect 30-minute delays. And on 253 near Singley Cattle Pass, expect 15-minute delays weekdays. That wraps up the Caltrans Road Information Bulletin for Lake and Mendocino County State Highways. Like us on Facebook for more updates and info on the type of work we're doing. That's Caltrans, District 1.
Granite Construction's annual chili cook-off benefiting the Boys and Girls Club of Ukiah is Friday, September 8th, beginning at 6 p.m. in downtown Ukiah at the Alex Thomas Plaza. Come enjoy the music, chili, beverages, raffles, and bounce houses. And cast your vote for People's Choice. Call the Boys and Girls Club at 467-4900 or 489-2050 for more information.
Raising your family, tending to your animals, growing your own produce, preparing for the seasons, living the country life. Hi, I'm Jody Henke, host of Living the Country Life. Catch me every Monday through Friday at 9:35 a.m. and 4:35 p.m. for ideas and inspiration for your place in the country. That's Living the Country Life here on AM 1270 and 96.5 FM KXBX.
We bring the community closer together, supporting business in every way. We're helping make your dreams come true, working hard for you.
The Lake County Chamber of Commerce would like to recognize their Member of the Month Business Design Services. Robert Bocabella, BFA, is principal and founder of Business Design Services and is a certified interior designer in private practice for over 30 years. He provides designing to fit the vision in collaboration with writing service at earthlink.net. To contact him, call 263-7073 or email him at rb@businessdesignservices.com or visit his website at businessdesignservices.com or on Facebook at Business Design Services.
Lake County Chamber of Commerce, we're steady and strong, help us shape the future.
Okay, we're back.
We're back, and Paul, I hope you never have this. This is a disease called restless leg syndrome, and it's a disorder of part of the nervous system that causes an urge to move legs. Because it usually interferes with sleep, it's also considered a sleep disorder. I have somebody in my family who I can't name because it'll get reported to Rotary, and then there'll be a fine involved. And but they have very uncomfortable sensations in their legs, and sometimes arms or other parts of their body. They move their legs to relieve the sensations, and it causes an uncomfortable, itchy condition with like pins and needles, like they're going to sleep, or feeling a creepy, crawly feeling in your legs. They're usually worse at night, and especially while lying or sitting. This ranges from mild to intolerable, and symptoms can come and go, and severity can vary. They're worse in the evening and at night. For some people, they may cause severe nightly sleep disruptions that can impair the quality of life. I have never seen anybody so severely affected as the person that I live with. It affects up to both sexes, but it's more common in women and may begin at any age. And with her, it became as a young child with leg cramping. It's an often recognized or misdiagnosed, especially if the symptoms are intermittent and not all the time. Most cases, the doctors don't know why people get it. They suspect it's the genes that play a role. Nearly half the people also have a family member that has RLS. Other factors are chronic diseases, iron deficiency, kidney failure, peripheral neuropathy. Some types of medications actually can cause these things, but these are really difficult things. It's the time of night when it occurs. It's extreme. It gets worse and worse. If you don't take the medication around 7 or 8 o'clock, by 9 or 10 o'clock, it's almost impossible to stop the tremors. And in the cases that I'm associated with, there's a pounding in the legs and just lifting them up and slamming them into, and it's an involuntary movement. They don't even know that they've done it. If they're extremely tired, they don't even wake up through this. But most of the time, you kind of wish they were asleep so this wouldn't bother them, because the pain is unbelievable, from using wet towels, hot wet towels when you're in somebody else's home and it's happening at nighttime, or putting towels in the dryer and heating them up so hot that you can barely touch their skin, or getting in a bathtub and soaking them for 10 minutes or so to get them to at least disappear enough that you can't, they won't disturb you when you're trying to sleep. So it's very, very difficult to control. It's terrible to be watching. And if you have other diseases with it, such as Charcot-Marie-Tooth and peripheral neuropathy and all those things that you take medication for, and it still doesn't stop it, it becomes really difficult to control. Other factors, including alcohol use and sleep deprivation, may trigger symptoms or make them worse. Improving sleep or eliminating alcohol in many of those cases may relieve symptoms. That doesn't mean it will, but there's always a chance that maybe it can. Lots of different medications, about 3 different medications for this, which is Mirapex and a couple of other diseases, that, or a couple of other, Requip is one, and one other one that is very effective. But when you have the iron deficiency as well, it becomes even more difficult to control, because the iron is what manufactures blood cells, and the blood cells have oxygen in them, and the oxygen carries the circulation to the lower extremities. So not the easiest thing to control, and certainly not anything that we would wish that any of you would have. But if you do have it and you're dealing with the pain, I understand how difficult it is to control it, and a surprisingly number of females have it, and very, very difficult to live with. So you have all my best. The American Academy of Pediatrics recommends that everyone aged 6 months or older should receive an influenza vaccine, 6 months or older, which reduces the risk for serious illness and death. The policy statement came out on September 4th, and in an October issue coming out of Pediatrics Magazine, there are a lot of people that are giving the flu shot already. I would just caution you about, not because we don't have the vaccine yet, but the potency of that flu vaccine with the different strains of virus gets weaker and weaker as the months go by after you've taken it. If you're getting it in August or September, the chance that you're going to have full potency of that medication in late February or March, when usually the disease is at its height, is going to be difficult. Now, I know you may have physicians that say you need to get it right now. If you want to, you can do that. We will let you know when we have the vaccine. We expect to get it later on this month. We expect to be full-fledged in it the month of October and finish it probably in the month of October for the majority of people. On this from the American Academy of Pediatrics, they say getting the flu shot as soon as it's available should be on every parent's checklist, along with other back-to-school recommendations. We know that the flu should not be taken lightly. Everyone in the household, including pregnant women, grandparents, and child care providers, should be vaccinated to help prevent its spread. Now, if you're pregnant, you can get that at any time, no matter how far along or how early you are in your pregnancy. More than 100 children actually died last year in the United States during the 16-17 season, and thousands more required hospitalization for severe illness or complications from influenza. Excuse me. 80% of those who died were unvaccinated. So the American Academy of Pediatrics says to offer it to all children 6 months and older as soon as it's available, so the children are protected before the influenza season begins. The inactivated vaccine, this is the one that's not a live vaccine, is an intramuscular that we put in an arm or leg because it's fully inactivated. It doesn't cause the flu. So anybody that thinks you can get the flu from the vaccine, as long as it's an inactivated vaccine, and that's the one that we're giving 95% of the time. It comes in two forms. It comes in the trivalent form, which protects against 3 strains of the influenza, 2 strain A and 1 B, and the quadrivalent form protects against 4 strains, which are 2A and 2B. At our Brunos location, we have all quadrivalent. At the Hill Road location, we have trivalent and quadrivalent, but not as many. Neither inactivated formulation is preferred over the other, although manufacturers anticipate an adequate supply of quadrivalent. If people only have trivalent, it's not that much more effective. Children should receive their vaccinations or vaccination by the end of October if possible. Those who require 2 vaccines are children 6 months through 8 years who haven't previously been completely vaccinated. They should get their first vaccine early in the season for the best protection. This year, for the 2nd year in a row now, and I'm not sure why this occurs, the American Academy of Pediatrics supports the recommendation of the CDC to not use the live attenuated intranasal vaccine, which provides poor protection against influenza A. It wasn't effective last year at all. It's not going to be effective this year at all. I don't know who will even manufacture it, if anybody, but this is the one that's the intranasal vaccine. It's a live vaccine. It can give you a little sample of what the flu might be like, but it's not severe. We, as pharmacists, make a very special effort to vaccinate all children 6 months and older who have medical benefits that put them at increased risk. Those include preterm babies, those with chronic medical conditions such as asthma and chronic lung disorders, cardiac disease, diabetes, other metabolic problems, and those with weakened immune system. That's quite a list for kids 6 months and older, but you'd be amazed about how much of them are effective by some of these things. All women who are pregnant, considering pregnancy, postpartum, or breastfeeding during the influenza season should receive their influenza vaccine. Studies have shown that infants born to vaccinated mothers have a better influenza outcome if they contract the disease, and all those who care for children should also get the flu vaccine. It is not contraindicated in children with a mild fever or a mild fever illness, especially if they have mild upper respiratory tract infections or allergic rhinitis. Children in whom the clinician diagnoses a moderate to severe illness should wait until the resolution of it to be vaccinated. Infants younger than 6 months should also not receive one of those inactive vaccines. It's the best available preventative measure we have against influenza, yet there's lots of room for improvement in influenza vaccine because all vaccination rates have been way underused in both children and adults during the past 7 years. We have no idea what the flu season is like. I'm sure you've heard of us talk before about how we are determining what strains to put in the vaccine. We do this a year ahead of time, so we're strictly guessing. Last year, the vaccine was 65% effective. There hardly is any vaccine that's 100% effective. I had a lady call me a couple of days ago that said she had got the Zoster vaccine for shingles, and she thought it was permanent. And I said, there isn't any vaccine that's 100% permanent, but especially Zostavax, which is a live virus also, was only supposed to be effective for 8 years. They are coming out with a second form of that shingles vaccine that's supposed to be an inactive vaccine that is supposed to be a lot more longer lasting than the one they have on the market. Say you don't get a flu shot and you want to take an antiviral medication to help control the flu, but that's not a substitute for the vaccine. The only antiviral medications recommended during the season coming up for chemoprophylaxis or treatment of influenza in children are Tamiflu and inhaled Relenza. Pediatricians should attempt to promptly identify children suspecting of having influenza for an initiation of the antiviral treatment, which indicated to reduce the mortality and morbidity of it. That means the chance of dying or the seriousness of this. It's an important factor in the treatment of children with present influenza-like illness. The best results, this is the kicker, the best results are when the treatment is started within 48 hours of onset of the flu. You would be amazed at the number of people who don't realize their children have the flu until well beyond that 48 hours, which is 2 days. And the medication is only going to slow the severity down and the duration of the flu about 2 to 3 days. So you can see how important it is to get the vaccination instead of waiting for an antiviral medication to take place and keep you from getting the flu rather than treating it after you've got it. We were talking a little bit about long-term care, and in the last few minutes we're going to kind of go over some of the things that ways you can afford the care you need. And one of those is by doing a lot of research, discovering what kind of help that you need or your parent needs. Do they need somebody to take over all their daily cognitive activities? Are they in an isolated place now where they need to be closer to some place that has a nursing home or a skilled nursing facility or a residential care? You want to know how good is the quality of care. Make sure that the residence that you go into is provided a license to do that, and you need to know what the real costs are for the care. Ask about insurance policy that you might have and whether your parent needs or you need a higher level of care to cover that. And can your parent or you get kicked out of a nursing home because of something you didn't know about? Long-term care insurance, the median cost to a semi-private nursing home is around $82,125 per year, not for the insurance, just to be in that home. Assisted living runs about $43,000, and with home health aides charging a median of $20 an hour. So for a few $1,000s a year, you could get insurance. Some of them have ones that you can buy life insurance with, as well as just getting the care for your family. There is, you need to find there's a place that has open beds so you can make sure if you decide to put your parent or yourself in one of those homes, they are going to have a bed available, and if you have to leave and go in the hospital, is there going to be a bed back for you. So I'm just looking at the map here, and Washington, Oregon, and California are three of the highest states on the West Coast. Wyoming, Colorado, and Kansas. In the mountain states, Wisconsin and Illinois. In the middle states, and then Tennessee, Virginia, New York, Vermont, Maine, and Alaska for the outsides, and so is Hawaii. Hawaii costs you, if you're thinking of going over and retiring, not that much different from California, $49,500. Alaska, $69,000. You would think it would be just the opposite, but it isn't. The highest, I think, was the District of Columbia is $80,400 a year, and most of the rest of them are in the 30s and 40s. So Massachusetts is $65,000 a year. So as you start to age, or you're into the aging process, you need to do some planning, or if it's for your kind of yourself, remember there are different kinds of facilities. There's skilled nursing facilities which take care of everything for you. There are assisted living facilities where you may have your own apartment, and you buy that apartment. You can also sell that apartment if you have to leave and go to a skilled nursing facility. But you need to find those things out. If you're, my mother was in an assisted living place in Des Moines, which combined facilities. So when she got worse, they took her to another level, and she went into the skilled nursing facility of the same company, the same insurance. The cost had elevated, of course, because it required more care, but a lot of the people that were in the assisted living section transferred with her into the skilled nursing facility, so she had friends there. So it's important for you to know that there are lots of options when you go in, and if you want to go into a residential home where they have maybe 5 or 6 families, make sure that they are licensed to provide assisted living, and take a good look at the residence inspection record, which indicates how often it's been checked and if there's any complaints. The best information about quality of care could come from the people who visit the residents there. So ask the residents specifics about the care, whether the meds are delivered on time, how management responds to complaints. There's always a turnover in those facilities. If you look in the paper, they aren't hotels. They're skilled nursing facilities, and the residential care places are homes that take care of them and treat them usually very, very well, and until it's the point where they can't take their own medications, and then they have to transfer to a different kind of facility. Even a skilled nursing facility, an assisted living place, lets them have their individuality. We have one down at the other end of the lake in Clear Lake, and we have Meadowood and Rocky Point, and evergreen here for skilled nursing facilities. I used to take care of all of those facilities. I know how they take care of patients. Like I say, it's not a hotel, but very good care in most of them. You just have to be aware that there's going to be a turnover in the people at the lower end of the scale, because a lot of them don't want to make this a permanent type thing for them. Many of them go on to be LVNs and registered nurses, so they can make more money, but they have to start someplace, and that's usually where they start. We have about 5 minutes, and there's a huge thing here on obesity, and I don't really want to give you a little hint of just a few things. And they keyed in consumers about sodas, and if you swap a soda daily for water, you would eliminate 119 cups of sugar per year, 14 pounds of body weight you would lose per year. Water's the best option. It does wonders for the daily workings of your whole body while contributing no calories. If you took milk for a year, an 8-ounce glass of milk, and switched it, the daily soda for the milk, you would save 97 pounds of sugar a year and 6.5 pounds of weight you would lose. Dunkin' Donuts iced coffee with whole milk and sugar, you would save 84 cups of sugar a year. This is just one soda and a day, and 9 pounds of body weight. For Honest lemon tea, 80 cups of sugar you would save, 9.5 pounds of body weight. Gatorade, and this is one of the things I try to tell athletes a lot, and they don't really seem to accept it. This is a thirst quencher. This is an original orange. You would save 57 cups of sugar. You'd lose 6 pounds. The switch is better than soda because it's mostly added sugars and water. The calories are still empty, meaning it's like wine. There's no value to those calories. Plus, unless you're exercising vigorously, you really don't need the extra sodium. So if you're an athlete and you're out on the field, you do much better drinking water than you do Gatorade. Now, I'm sure the trainer from the 49ers would tell me differently, but I'm just telling you as a clinician. Tropicana orange juice, 14 ounces. If you switched that daily soda for that, you would save 47 cups of sugar, 3 pounds. Like milk, pure fruit juice offers vitamins and minerals, also contains more natural sugar, upping its calorie count. Instead, drink water and eat a whole piece of fruit for the filling and healthy fiber. Paul, I want to remind you, do you remember the drug we were talking about last week?
I don't remember what it was called. I had it written down, but no.
Canakinumab.
There you go, canakinumab.
And it was a statin-like drug that it cost $200,000 a year, and it brought the LDL level down very, very low. We'll talk about that again next week. So, want to remind you, we're Northlake Medical Pharmacy with 2 locations for you at 5136 Hill Road East across from Sutter Lakeside Hospital. Call us there at 263-6192. And outside the Bruno Shop Smart at 347 Lakeport Boulevard, give us a call there at 263-1328. Thank you, Paul.
Thanks, Bill, and we'll see everybody back here again next Wednesday at 10 o'clock for Health Talk here on AM 1270 and 96.5 FM, KXBX, Lakeport.